When you think about, well, what makes health? I don't mean what makes illness necessarily, but what makes health? It's having a good education. It's feeling connected to your neighbors. It's having the resources available so that you can use fresh fruits and vegetables in your cooking. There's big disparities between the health outcomes if you grow up in one neighborhood versus another. So the health department's strategy for the last 15 years has been to put serious health department resources into specific neighborhoods. Those neighborhoods had long-standing disinvestment and are the result of intense racial segregation and really segregation by socioeconomic status as well. And I get the privilege of being the Assistant Commissioner and Medical Director for the Bronx Neighborhood Health Action Center. We work to make sure that the systems and the policies and the practices in this neighborhood are as health promoting as possible. Each day is completely different from the other. Early in the morning, working, maybe getting something set up in a farmer's market, or going to a community meeting in the evening or on a weekend, so it's not a 9 to 5 kind of thing. If we're doing our job well here, you're going to come into the building and you're hardly going to see any staff because they're out with people in the neighborhood. So community organizations, clinics, of course, and then other city agencies have been great partners. Department of Education as an agency, Department of Parks. We've been, along with our colleagues in the health department, working on infant mortality. It looks like a single indicator, but it really has to do with the health of the mom in particular, and the parents and the family health, and then the conditions of the clinical care around the child being born, and then the world that they're brought into. In particular, we've been concerned with young people and making sure that their reproductive and sexual health is optimized. And we surveyed over 50 high schools in the South Bronx. We brought in our colleagues from the Department of Education, and so now we work with high schools. We work with over 140 high schools in New York City so that we help train their teachers to deliver scientifically developed curriculum with each school. We work with the clinics in the neighborhood, and then we really link that clinic to that school. So in the curriculum, when it says visit or call a clinic, the class takes a trip to the clinic and they go to the clinic. And that can be a game changer for young people. The amazing thing about working in city government is if you can get some change, it can have a big impact on a lot of people, and you can feel like a lot of people contributed to this and it's where you want the city to be. That makes me feel very lucky.